Welcome back to Medical Facts Today. Have you caught the buzz about the super flu? It sounds scary, but we lean on facts, not fear. Today, we'll explore the troubling public health surveillance report about winter 2025 in the UK. The statistics are alarming. Hospital admissions for influenza have skyrocketed by 55% in just 2 weeks. Currently, we have around 2,660 flu beds occupied, and winter has just begun. Why is this winter more challenging than last year? We're facing a perfect storm. This includes a drifting virus known as subclade K, a significant vaccine mismatch, and an already strained healthcare system. Stay with us. By the end, you'll understand this super flu, why swallowing feels painful, and why January 2026 might be chaotic for the NHS. Let's kick things off with a fundamental question. What is this super flu? Firstly, super flu isn't a formal term. It's a catchphrase for unusual virus events. The main character here is a variant of influenza A, H3N2, specifically subclade K. H3N2 strains have a reputation for quick evolution and higher mortality in older adults. What makes subclade K particularly worrisome? Virologists describe it with Velcro-like properties. This past summer, it developed 7 mutations on its hemagglutinin protein. These changes enable it to attach more effectively to human cells. So, what's the outcome? Outbreaks are explosive due to higher viral loads and shorter incubation periods. But we have our vaccines, right? Unfortunately, no. The 2025-2026 vaccine was designed based on 2024 strains, and subclade K came to light afterwards. This leads to a classic mismatch. Even worse, the vaccine underwent egg-adaptive mutations. The vaccine virus changed while growing, diverging from the wild virus. Consequently, vaccine effectiveness has significantly dropped, especially for adults. Now, let's discuss symptoms, as there's much confusion. Many report a razor blade throat, which is painful to swallow. Most assume it's flu-related, but that may not be accurate. This specific symptom likely stems from a circulating COVID-19 variant known as Nimbus. This variant affects the upper airway, causing that painful throat sensation. How can we differentiate the two? H3N2 subclade K strikes hard and swiftly, resulting in sudden high fever, muscle aches, dry cough, and extreme fatigue. Unlike typical flu, this variant can also cause gastrointestinal symptoms like vomiting, especially in children and older adults. This confusion has led to overcrowded emergency rooms, as individuals mistake COVID-19 symptoms for the super flu, who is spreading this virus. Data reveals that children are primary carriers. In week 49, children aged 5 to 14 had a whopping 45.9% positivity rate. Schools act as amplifying hubs for the virus. Introducing the immunity gap. During COVID, lockdowns suppressed flu circulation. This suppression means children lack natural immunity to H3N2, making them more vulnerable now. The report indicates what we thought was rebound flu cases last season was just the start. We are in a multi-year recalibration of respiratory viruses. Currently, the virus spreads in schools. Expect increased pressure on elderly wards as kids infect their grandparents. Now, let's analyze the impact on the NHS. The report describes a worst-case scenario where flu admissions exceed capacity. NHS England characterises this as hospitals starting to stretch their resources thin. For reference, 2,660 flu beds were taken by December 11th. Compared to last year, that number sat at merely 402. Recently, University Hospitals Birmingham faced a crisis due to an influx of flu patients. The situation is dire, as critical care beds fill up, risking trauma care availability. Moreover, there's a looming gender piece risk from the resident doctors' strike. Scheduled for December 17th to 22nd, this will eliminate nearly 50% of the medical workforce at the flu's peak. Moving on, let's review vaccine effectiveness. For children, the live nasal spray shows promise, with 70–75% effectiveness thanks to mucosal immunity. However, adults face grim numbers. Their vaccine effectiveness has dropped to 45–55%. The elderly, who need protection the most, see effectiveness at only 30–40%. While the vaccine may prevent deaths, it fails to effectively halt mild cases or spread. Additionally, flu isn't acting alone. We're facing a triple-demic. Norovirus cases are rising, taking away beds for sanitation needs. Plus, COVID-19, Nimbus, may peak again in January. What's ahead for us? Predictive models are concerning. The Christmas season acts as a major mixing event. With high flu rates among children and vulnerability in the elderly, we anticipate increased hospitalizations among older adults in early January 2026. Current models suggest bed occupancy could soar from 2,600 to between 5,000 and 8,000, putting operational capability at risk. It's vital to stay informed and take action. First, know the difference. Painful throat likely suggests COVID-19, while flu symptoms hit hard and fast. Second, consider therapeutics. Antivirals like Tamiflu can provide significant relief. Test early. Lastly, masks remain a useful measure in crowded places. The government recommends using them in public transport settings. This winter is rewriting healthcare protocols. It shows us that influenza poses a continuing health menace. Stay safe, maintain hygiene, and help your vulnerable neighbors this January. You've been watching Medical Facts Today.